orthopedic surgeon out of Lincoln, Nebraska. I've been coming to Hebron to provide services here at Thayer County Hospital for 24 years now. I grew up in a small town in Kimball, Nebraska, a town very similar in size to Hebron, so in a lot of ways it feels like I'm coming home when I come here, and that's one of the reasons why I continue to provide care for so long, is I feel like I can really relate to people in smaller towns. I did my orthopedic training at the University of Iowa for medical school, and then I actually lived in Vermont and went to the University of Vermont and did my orthopedic training. And then I also did an upper extremity fellowship, hand, shoulder, and elbow at the University of Minnesota before I came to Lincoln. Thayer County Hospital provides a lot of services that I think the general public is not aware of. We are doing operations that are quite sophisticated here. My favorite operation that I do here is shoulder arthroscopy. We have the highest quality equipment here. It's an equal caliber to the equipment that's available in the Lincoln hospitals. So I'm really proud of that because they've really kept up with the current technology. We're able to do shoulder surgery through tiny incisions that we used to have to do through big open incisions, which greatly accelerates your recovery and also causes a lot less pain during the surgery, during the recovery. So that's something I'm really proud of. We just started doing that here about 8 years ago. About 8 or 10 years ago, we also started doing total knee replacements. We were actually the first small hospital in eastern Nebraska to start doing total knee replacements, and I think that's a fact that most people don't realize, is that this hospital has been very progressive and ahead of the curve on providing that type of services. Our total knee program has gone very well. The other services that we provide here are more common or basic orthopedic procedures, such as common hand surgeries like carpal tunnel releases, trigger releases, removing ganglion cysts. We also do knee scopes and foot and ankle surgery here as well, and other orthopedic procedures as well. One of my favorite things about providing care at Thayer County Hospital is that I feel like I'm coming home. As I already mentioned, I'm from a small town, and this makes me feel connected to a small community like I grew up in. I've also been so impressed with the quality of training that the staff has here. During calm days and crisis days, they react and provide safe care here. And I've just been so impressed with especially our current OR staff. They are the most talented group of professionals, our nurses and our anesthetists, that I have worked with in any rural town that I've worked in since I started my career 24 years ago. Well, the quality of care that I provide here is equal to that I provide in Lincoln. I have a philosophy and a rule, and my philosophy is that if I can't do the same quality of work here that I can do in Lincoln, then I won't do it here. And I've been doing that for 24 years now, and I have maintained that policy, and this hospital has risen to provide that. Patients do not need a referral to come see me. You can just call the specialty clinic and make an appointment to see me. You're also welcome to see your primary care doctor and visit with them about the problem and determine if you need to see me. There's a lot of things that they can do that you don't need the orthopedist to see, but you are welcome to come to see me at any time and make an appointment with the staff here at the specialty clinic. I'm currently coming to Thayer County Hospital about once a month. I also provide some services in the area if you needed to see me when I'm not here. And of course, I have a number of people who come to see me in the Lincoln Clinic. I also wanted to let people know that I am now set up in my office where I can do telehealth. So I can visit with people in the comfort of their own living room and start the process of doing the workup in the event that it's quite a long wait before you come to see me. What we like to do there is facilitate your care, maybe order different tests, and then I would see you in Thayer County and examine it and confirm what we talked about on the telehealth visit. I'd like to just say a little bit about the benefits of having the surgery locally. One is that I think that people in general feel more comfortable and calmer when they're close to home. And I would assure you that the quality of care you're getting for the operations that we are doing here is equal to that in Lincoln. It's a much easier trip. You don't have to get up at 3 in the morning to make it to Lincoln by 5 in the morning. You get there 2 hours before surgery starts at 7, which is a huge convenience because as you recover from surgery, you're already get worn out. Also, it's just easier on the family to not have to make such a big trip on a day of surgery. We also have capabilities to have people spend the night after their surgeries here. We have great rehabilitation services in Thayer County. Most of you know they opened up a new rehab center approximately 3 years ago that is just state-of-the-art. It has a walking track, it has aqua therapy, they have an aerobics room, they have weight machines, they have exercise machines, and of course, the staff, which I've been working with for a long time, our physical therapists and our occupational therapists are top-notch people. I can tell you that they do such a good job of communicating with me. And in fact, I find that sometimes the therapists here do a better job of communicating with me compared to therapists in the big city or in Lincoln, where people are more spread out and there's just it's just harder for people to communicate. And so when I'm here, I get notes from them. Sometimes there's some personal communication when they walk up and actually visit with me about patients. And it's just really a great experience for people to rehabilitate and recover from their surgeries in this community. I'd like to make, as an orthopedic surgeon, I would like to make a few comments about bone health. I see a lot of people who don't know the basics of bone health to keep your bones healthy. And this starts as teenagers, and especially in teenage women, where we know that the risk of fractures as you get older is such a significant problem. Bone health has 3 main components. One is nutrition, and the nutrition has to have adequate calcium in your diet. That means dairy products, certain foods like kale, broccoli, beans, and things of that nature. People should know what foods have good calcium sources. Most people do not get enough calcium, and most women especially should supplement with a calcium supplement. And we recommend it twice a day, 1 in the morning and 1 at night. The next thing is vitamin D3. Because we're often working inside during the cold winters and we're working inside during the hot summers, many of us, in fact most of us, have a vitamin D deficiency because we don't get the vitamin D from the sunlight. Therefore, it's really important to supplement. The amount of vitamin D3 that we now supplement with has increased compared to previous recommendations. The previous recommendations, say 10 years ago, was about 1,000 international units a day. Now we're recommending somewhere between 2,000 and 5,000 international units a day of vitamin D3. And it's a very important supplement. Without vitamin D, your body cannot absorb the calcium from your gastrointestinal tract. And so it's very important to supplement with that vitamin D3 to keep your bones healthy. In children, if you get a vitamin D deficiency, it's called rickets. In adults, their bones aren't growing, and it's called osteomalacia. When you get osteomalacia, it's basically the start of brittle bone disease, which leads to osteoporosis. So vitamin D deficiency leads to that problem. The third one is just exercise, weight-bearing loading exercises, walking for your legs and your back, and lifting not necessarily heavy weights, but light weights, resistance exercises with your arms. And that can be activities such as gardening. It doesn't have to be a weight machine, but you should daily work on strengthening your arms and do resistance training of some sort. Currently, there's been a huge change in the medical treatment that can be provided for bone health. When I started practice 24 years ago, we had a few medications that slowed the further deterioration of the bone. There's a medication called Fosamax that came out, and it was kind of a great drug that everybody thought was going to be great. But the problem is that medicine only stops bone resorption. The medical treatment starts with a bone density scan. You cannot tell from a plain X-ray how thick a bone is. with a test called a DEXA scan, which is offered at Thayer County Hospital, you can find out at that point in time what the state of your bone health is. Once your doctors know what the state of your bone health is, then they can initiate treatment. And the exciting thing about osteoporosis treatment that we have now available is that we can not only keep you from losing bone, but we can actually build your bone back up. There are 3 main medications that we have available now. The newest one is called Evenity. We also have Tymlos and Forteo. And unlike the older medications, which only stop your bone from getting worse, we can actually build you back up if you've lost too much bone, which might prevent you from having a hip fracture, or might prevent you from breaking your wrist when you fall on an outstretched hand, or having a terrible, painful back fracture when you get a compression fracture of your vertebrae. So these are the things that we're trying to move forward with, not taking care of broken bones, but preventing them. But it really starts with especially women and girls as teenagers. So my daughters, who are now 24 and 28 years old, started taking calcium supplements when they were in high school. And I would just encourage everybody to start good bone health practices at a young age and teach your children about it. And then those of you who didn't learn and start that at an earlier age, get started right now. Well, I'd just like to thank you for letting me care for you and your community over the last 24 years. I've really enjoyed coming out here and really enjoyed the relationships with the doctors here, the physicians, assistants, and the nurse practitioners, as well as your physical therapists, and of course the nursing staff in your operating room.